Okay, so we're just getting started on the left knee. We're looking in the medial compartment first. This is where that bucket handle meniscus tear is. I just reduced it, so I don't want to take it apart too much, but here as we look, you can see this is the torn edge. Okay, and then here's the inner edge that's torn, so removing that would involve removing most of that meniscus on the medial side. We're going to try and repair what we can and hopefully get as much of this to heal as possible. Okay, but you can see how that's unstable, how that can move back and forth. Okay. See how that could get caught in the knee. Okay. So we're going to go ahead and get that organized. Here's your anterior cruciate ligament. That looks great. As we look in the lateral compartment, a little bit of fraying there, and there's a little bit of a tear there, isn't there? See, there's a little bit of a tear right here, so we're going to have to deal with that too. Just taking a good look at everything first before we get started. And now, as we look up here at the patella, patella's actually checking out pretty good. We'll look at that a little bit later. So I'm going to go off on the video for a minute. Just want to give you another picture of how this bucket handle tear can get in the way. You can see it's still attached in the front of the knee right here, and it's attached in the back, and it just gets stuck here. And to reduce it, we need to get it back in proper position just like that. Now that looks a lot better, so we'll get to work on tacking that down. Pause. Okay. Okay, so we've got this medial meniscus repaired as best we can. You were missing a little bit out of the middle, so we didn't debride anything. We just put in some sutures around the horn there, and hopefully that'll help stabilize that. We've ranged your knee, as you can see here, and it's not going anywhere. We just have to hopefully give that a chance to heal. We're going to look in this lateral compartment next. Okay, so we're just trimming back the lateral meniscus a little bit, and that looks good. I don't want to take any more than that. We've still decided, or making a decision, whether or not we're going to, you can let go, whether we're going to come back and do anything else to the anterior horn of this medial meniscal tear, because remember that bucket handle extended all the way around through the anterior horn, but it sure looks stable there. I'm just worried about this gap right here. So we're going to have a look at that. One sec. Okay, so here we are just taking a spinal needle. We're just looking at repairing this anterior horn here. We're just going to probably do a hay bale suture all the way around this just to hold it down. Hold the camera. Okay, just want to show you what we're doing here. We're going to pass this relay and just capture it right there. There's a lot of ways to do this. This is just one slick little way to do it. Okay, so here's our little hay bale suture right there. We're going to try and tie that, and that'll give us some anterior horn stability. That's the plan anyway. We're just tying this right up against the medial capsule. Can I get a mosquito, please? Okay, and so that's going to be it. We're going to go ahead and get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.